Welcome to the Social Business Engine podcast, where today's thought leaders discuss how they're using the latest social media strategies and technologies in marketing, sales, customer service, and HR. Get ready to be inspired as our guests contribute to your digital transformation through their stories, knowledge, and insights into what works in today's digitally connected world. And now, here's Bernie Borges, your host of the Social Business Engine podcast.
Hey there, welcome to episode 126. I'm Bernie Borges, your host of the Social Business Engine podcast. Hey, thanks for listening. On this episode, you are going to meet Sarah Burns, Editorial and Social Media Strategy Manager at Indiana University Health. Sarah will discuss how IU Health has implemented an online news hub to increase their reach and provide consumer-friendly content for their audience. Now, this episode is sponsored by Outward Media, Inc., a leader in the direct marketing industry. Later in the show, I'll tell you about a valuable offer from Outward Media, Inc. And now, let's get to my interview with Sarah Burns, Editorial and Social Media Strategy Manager at IU Health. Sarah, welcome to the Social Business Engine podcast.
Thank you, Bernie. I'm pleased to be here.
Well, I'm thrilled to have you here. I remember when we first met at the Social Media Strategy Summit in New York City. I think that was in June, if I remember correctly. And we had a little bit of conversation about what you do at IU Health. And I think I may have revealed to you that that's how I find my guests to come on the show. I meet really interesting people like you at events, and I knew that I wanted to share your story at IU Health on my podcast. So thank you for being here.
Oh, thank you so much. It's a pleasure to be here.
Why don't we begin, Sarah, with just an overview of IU Health and tell us about your position as Editorial and Social Media Strategy Manager at IU Health.
Sure, absolutely. Well, so to begin, IU Health, Indiana University Health Hospital, is the largest research hospital in the state of Indiana, and the flagship offices are located in downtown Indianapolis. The main hospital is there with the Children's Hospital, but there are a lot of state partners sprinkled throughout the state of Indiana. So we have hospitals in Muncie, Indiana, and various, cities throughout the state of Indiana. So my position is the Editorial and Social Media Strategy Manager, and I work out of the flagship office in Indianapolis. And I was hired last year in kind of a quest to kind of revamp the social media platforms at IU Health and really kind of help the hospital, really storytell more and create organic, newsy content for them on the platforms.
That's interesting. Help the hospital do some storytelling. So let's talk about the journey. Like, how did IU Health actually get to that point of knowing that you wanted to do storytelling?
Well, it kind of predates my arrival. Basically, what happened is the public relations director found that there were a lot of stories that she was encountering, a lot of instances that she was encountering from a PR perspective that really could lend themselves very easily to a social media platform formula. Stories that could be told in a way that were very visual, either through a film short formula or through a blog formula. And there was a blog that existed, the IU Health Strength blog, and she really thought about how to reposition the blog and make it kind of more of a newsy destination. And so I was brought on kind of in her idea to make this news hub or health hub, if you will, come to fruition.
Okay, so let's talk about that health. You call it the IU Health News Hub, right? Is that what it's called?
Yeah. That's correct.
So let's talk about, what is it? How do you create content for it, et cetera?
So for a very long time, prior to my arrival, it was just kind of a blog that had just general health and wellness content. And so when I came on board, being a trained journalist myself, and thought about it in a different way. Right now, I use it as a platform, and we rebranded it to be the Consumer News Health Hub, as you mentioned. I use it as a platform to do storytelling. So I tap our physicians that work for our hospital and for the state partners, and have them be sources pieces on content that range anywhere from breaking news trends to just health and wellness topics to, film shorts. We're really positioning the blog as a lens that our readers can look at. And so they feel like they're getting news, but they're also getting a taste of what our hospital has to offer from a physician and health team member standpoint.
So, Sarah, do you want the readership of IU News Health Hub to be the consumer, people like you and me who are potentially patients out in the community, or do you want it to be physicians or all the above?
Well, it's kind of interesting. It's actually a multidimensional target focus. So originally the blog, the Health News Hub, was for potential patients. But it's also a host of a lot of content about team members. And we find more and more that the people who work at IU Health are actually looking at that Health Hub and reading pieces on team members. We do a lot of team member profiles. And so it's really multidimensional. So we're tasked with creating a healthy balance of content that will be interesting to the potential patient, that will be interesting to the person who actually works for the hospital, and also to be interested to people who aren't even in the state, who may be potentially looking at our facility for future treatment.
Okay, so from a marketing perspective, then there's the potential to attract patients who are looking at your facility as a patient and potentially travel in because based on what they read on the hub and, of course, your website, they determine that that's the facility that they really want their treatment to happen in. Is that right?
Exactly, yes.
Okay. So you also mentioned, Sarah, that you tap into the doctors, and I have to tell you, that is a pleasant shock for me. And let me explain what I mean by that. I've been exposed a little bit to the healthcare industry, and I know that doctors are really busy people. So how do you get doctors to participate and contribute content?
Well, it was interesting. When I first came on board, one of the first things that I made an effort to do was meet with physician groups. So I would attend some of their weekly meetings and get to know them and socialize with them and really start to have conversations about social media and really talk to them about how it works. Some of them really shied away from it. Obviously, when we talk about healthcare and social media, we talk about potential HIPAA violations, and there are a lot of things that, quite frankly, can be a little bit disconcerting to a physician. So really, when I talk to them about social media, I talk to them about how they can use it as a conduit to disseminate information that they feel should be top of mind to the consumer, as well as position themselves as a potential individual brand or expert in their area of medicine. And that's really not a conversation that a lot of them had before. And so once we started to talk about the ways that they could disseminate messages that they found were really not top of mind enough to the consumer in the health realm that they were in, they were very interested. And also, the idea of them guest blogging for us, the idea that they could create content with our assistance and get the messaging that they felt was most important out rather than feeling like they would be censored or filtered. So really, that type of partnership prompted a lot of them to move forward.
I love that. So they actually partner with you and your team. Does that mean that do they actually do the writing and then your team does the editing, or do they dictate into a device and, narrate something and you guys do the writing? I mean, how does that work?
Sure. So when I'm talking to physicians and team members at IU Health, when I initially approach them to have conversations about social media, I usually talk about three main options. One is the guest blogging, the idea that they can write a piece of content and then, I'll be editing it with my team, and then they'll get to see the final before it goes up. We talk about just them serving as a source. So if I'm doing a story, let's say on Zika, they, sprinkling their quotes in and offering their expertise.
Right.
Or it can be something as simple as I'm trying to remember what that last alternative was. I forgot. I know those are probably the two most important ones, I would say.
Sure. No, I can see how. And so those are, they can either write guest blogs themselves or be a source of quotes. Okay, great. So let's talk a little bit about how you actually promote your content. You're obviously promoting it on social media. So do you want to shed a little light on which social media platforms you use and how that works within your team?
Sure. So Facebook and Twitter have been our common threads all along. Facebook I think, is the one we rely on most heavily to promote our content, and we've seen a lot of engagement through that. So the IU Health Consumer News Hub is where the content lives, and then we promote it on Facebook and Twitter. We also have Instagram and Pinterest accounts that we've opened up within the year. Our Instagram is growing at a very steady clip, and we have kind of a different strategy for that since it is so visually driven. And then Pinterest, again, we take a lot of the content that we create and try to figure out how we can format that into a motion graphic or an infographic to disseminate a similar message, but in a more visual content.
Can you elaborate on that a little bit? That motion graphic you just described, Sarah?
Sure. So when I'm talking about like motion graphic, I'm talking kind of like animation. Mm-hmm. So for instance, if Breast Cancer Awareness Month is coming up, so instead of writing out a piece of content on, step by step how to do a self breast exam, showing that from an animation standpoint in a motion graphic, maybe with some very arresting statistics about how the disease is growing and what have you, is an interesting and a different way to position that messaging.
Right. So you've got a pretty impressive content strategy here, and they're using social channels as a way to amplify the message and really extend your reach out to the community that you want to reach. Would you agree with that, Sarah?
Yeah, thank you. Yes, I would agree with that.
All right, terrific. Well, before we get to the next section, I want to talk about a look at a leader. I want to pause briefly for a message from our sponsor. Outward Media, Inc. is a leader in the direct marketing industry, providing businesses access to the largest SMB email database for the acquisition of new customers. OMI has a commitment to data accuracy that I find very impressive because it helps you identify your best prospects so that you can generate more qualified leads. In fact, OMI offers a 95% accuracy guarantee on all email data for 30 days. I urge you to download OMI's ebook, The Executive's 15-Minute Guide to Building a Successful Email Marketing Database, to discover the essentials for improving email deliverability. Now, when I read this ebook, I discovered at least 3 things that we needed to address. It's really a must-read for all digital marketers. You can get your copy now at outwardmedia.com/SBE, and you can also find the link to this ebook at our website at socialbusinessengine.com. Sarah, you've got this section called A Look at a Leader. Can you first begin with the background on that? Like, what was the strategy behind that? And then, of course, explain what that is for our listeners.
Sure, absolutely. So I came on board at a time when our longtime president, Dan Evans, he had been the hospital's president for a number of years, was getting ready to step down. And there was a lot of conversation about how to honor his contribution and legacy at the hospital from a content standpoint. And I had already been playing with, kind of an idea in my head about how to really honor him, but also all of the leaders at IU Health and how we could shine a spotlight on their contributions at a leader standpoint, but also give readers everywhere a peek into who they really were behind the office doors, what kind of contributions they offered. And so Look at a Leader really was born from that. The very first blog that we did was on Dan Evans, and then we just kept supplementing that with leaders and physicians in different dimensions of the hospital.
So it really gives these physicians an opportunity to be spotlighted, if you will, around their craft. I was reading one about how, his upbringing, and so you get a little insight into who they are as people.
You do, and you also get insights into their volunteerism, their philanthropy, things they feel passionate about, topics within the realm of their medicine and their expertise areas that they feel passionate about, and it really gives you a very secure look at who they are. And so that helps on 2 levels, right? So it helps to have the team members here at the hospital get to know who they work for or who they're working with in a better realm, but also it helps potential patients, potential people thinking about IU Health to better understand the people that they may or may not choose to interact with. So it really has been a very positive tool for us.
I'm wondering, Sarah, does that help you in recruiting? Does it help you attract physicians to your facility?
It has definitely been a boon for recruitment. I couldn't speak to any type of nitty-gritty quantifiable numbers.
Sure.
Just anecdotally. We have had conversations with our human resource department, who is charged with overseeing our LinkedIn platform, and they use our content, particularly Look at a Leader series, to put on LinkedIn. And, they have said to me on more than one occasion that they've had people come in, interview for jobs who, are inspired by those pieces of content, piques their interest. They like what they read about certain positions, and that gives them the messaging that they need to think, well, maybe this might be a good fit for me. So that's very encouraging on our end.
Awesome. I love that. Because, all businesses have the challenge of recruiting talent, especially talent that's in high demand. And certainly physicians qualify as talent that's in high demand. And in many cases, they can work anywhere they want. So that's really an awesome business benefit. And speaking of business benefits, this is the Social Business Engine podcast. Let's talk a little bit about that, Sarah. Let's talk a little bit about the impact of your content and social strategy. And first, if you could just kind of remark on, you mentioned to me before we recorded that your strategies had some impact on traffic to the website. You want to elaborate on that a little bit?
Sure, absolutely. So when we create our pieces of content on the News Hub, we try to embed links. So when we have a physician, chime in on a news trend, and we create a piece of content on that, we embed a link in there, so you can click on that and you can go directly to his web page to see, if he is available and what his expertise is in the area of medicine and locations that he practices in. And so we try to offer that added value and inject that in. And so it's just a great way to familiarize the readers with the IU brand, and then offer an added value of potential service there if they so deem that that's something they want to do.
Okay. And what about leadership? As it relates to all things content, all things social, you work in an organization, everybody's got budgets. So if you can just kind of talk to, what does leadership expect from this overall strategy?
Well, we're very new in our kind of revitalization effort with our social media platforms. Our C-suite has been extremely supportive, and since we kind of went from 0 to 60 here, prior to my arrival last year, our social media platforms were used kind of as a bulletin board, a hodgepodge, if you will, of things and services. It really wasn't a conduit for news and organic content, and so leadership has been extremely supportive with this initiative and really allow us the flexibility to grow at will. We don't really have hard pressure to meet hard and fast goals at this time. There's an expectation for us to continue to grow, but we really have the freedom to tinker right now and find the right fit for our organization.
Nice. I would imagine that you talk to peers at other health facilities. Is there a community out there of people like yourself at other health facilities where you just kind of talk to each other and kind of share, maybe not secrets, but, just kind of talk about what you're all doing and maybe support each other?
Yeah, well, we are a part of the Mayo Clinic social media organization. We are a member of theirs and have been for a number of years. We go to their social media residencies once a year. Okay. It's, the closest thing that we found to a group that has a similar strategy. And it's always interesting to see the different health systems at those conferences and to talk with them. They all have different formulas. Some are more journalistic in nature. Some are more marketing in nature. Everyone has their different targets and strategies. So at this point, that's kind of the only venue that we found that's similar to what we need.
Interesting. Yeah. Okay. All right. So now I'm going to ask you to bring out your crystal ball. You did bring that with you for this podcast recording, didn't you, Sarah?
Of course. Keep it in my back pocket.
All right, great. Because we need it now. So I just want to ask you to just maybe comment on where you think the overall strategy might be headed in the future. I'm not going to pin you down to a year from now or 5 years from now, because most of us can't really think realistically about that. But just where do you see things headed for your strategy?
I think as as we continue on in the next couple of years, the need for visual storytelling is going to become greater. I mean, I think print content, Health Hub content, written content is extremely valuable, but I think that there are a lot of other dimensions, particularly with younger generations, that are more appealing. So learning how to tell stories through photographs, infographics, motion graphics, film shorts, I think that's going to become even more vital. And I think that's something that we're going to start looking more closely at. And, at this point, I've kind of taken baby steps in those directions.
Interesting. You're already doing some motion graphics. Have you actually started doing anything with short films?
Not yet, but it's definitely something that we are seriously contemplating. Our Instagram account has been rapidly growing. So we are trying to think about how to kind of position that in a more optimal fashion as well.
Interesting. Are you doing anything with live video?
We have on occasion done a couple things with Facebook Live, and it's really done well for us. IU Health, we had the Indy 500 fly-in, and we've, kind of did that live. It did very well. Whenever we do it, it does well. We've only done it a couple times, but I think for us, the challenge is finding a natural formula for that type of treatment, making it not feel like it's forced. Again, right. Because our strategy is very much about organic and news content. We don't want it to look staged or feel forced for the reader. We want it to look natural, and it's very challenging to try to get those scenarios and take advantage of those opportunities that will lend itself to that formula. Right.
Okay, cool. Well, Sarah, we are at a point now in the podcast where I am going to summarize the kind of the highlights of our discussion. And then when I'm done, I would like to ask you to just kind of chime in with any elaboration, maybe anything I left out, or just anything you want to remark on, as well as make any corrections for my summary.
Okay, great.
All right. So we began our conversation with an overview of Indiana University Health. You're the largest research hospital in the state of Indiana, and how you came on board to help do storytelling. You mentioned that the PR manager that preceded you or brought you into the organization recognized the value and the importance of telling stories, both visually as well as in the written format, and how you launched the IU News Health Hub. Did I get the name correctly, Sarah?
IU Health Consumer News Hub.
Okay, IU Health Consumer News Hub. All right. We will make sure to get that correct in the show notes. And how you use it really as a platform to do all your storytelling. You tap into doctors, and it's a multi-dimensional target focus. I love that because you've got both patients who can get value from the content, but also employees who also read it and they can learn from it, and they can also tap into learning more about, the contributors to the hub. How you met with physician groups to really network with them and kind of explain to them how it works, how social media works. You kind of talked about the role of HIPAA and how you're able to contribute content and actually promote it through social media without crossing, that line of HIPAA, and how doctors can actually also use it to disseminate the information that they have available to them through their training and their knowledge. And it can also help them build their personal brand. And ultimately, what you're doing is you're partnering with those doctors to create content. And they can do it in one of two ways. They can contribute content that they write, or they can be a source of information and provide quotes to content that you write. And we also talked about how you promote the content from the News Hub on social media. You said mostly Facebook and Twitter, but you've got Instagram and Pinterest recently coming on strong. And you mentioned that Instagram is really growing rapidly, which doesn't surprise me. And you also explained that you've got animation content with motion graphic content. And so that really makes a whole lot of sense, again, given the nature of your business, right? You're a hospital. And so, the example that you gave of, detecting breast cancer and having a visual example of that as opposed to a written example of that. Then we also talked about a section on the hub that's called A Look at a Leader, and how it started with honoring a president who was, I believe, was outgoing, Dan Evans, if I wrote that correctly. And that really gives you an opportunity to look at these leaders and tell their story and provide insights into their personal passions, and helps the employees of IU Health get to know these leaders. It helps patients get to know these leaders. It also can contribute with your recruiting as well. We talked a little bit about that. And then we talked about the business benefits. And I remember how you said that, sure, there's been a great increase in web traffic, and that's really cool. You embed links so that there's certain things that you can, measure traffic to. But ultimately, it's really about just delivering great content for your audience, and how your C-suite is very supportive of the overall strategy, and they give you freedom to experiment. And that's really terrific. And we also talked about how you do some networking and education by being a member of the Mayo Clinic social media organization. Gives you a chance to talk with others and kind of compare notes on how, their approach to social media and content marketing. And then the last thing we discussed, Sarah, was the future, and how you really see a future that's just even more visual, more storytelling through visuals and motion graphics and even short films. And how you said that, you see Instagram growing rapidly, and that's probably going to continue to happen because of everybody's appetite for visual content. So that's kind of my highlights of our conversation, Sarah. And I just want to ask you to either fill in any holes or elaborate on any points that I made.
Sure. No, I think that was all on point. The only thing that I can add is that it has been really almost like a domino effect as far as our team members and engagement in social media, particularly with a look at a leader series. Obviously, I take meetings with physicians all the time, and in an ideal world, I would be able to meet with every one of them. Unfortunately, their schedules and my schedules don't always mesh optimally. But a lot of time, we will do a look at a leader. We will highlight a physician in a certain area of medicine at the hospital, and other colleagues will read that and feel very gratified by what they read, which makes them more likely to participate with us in the future.
Right.
Or other tangential health departments take notice and say, hey, you know what? We would be very interested in offering up our leader for that, or, why don't you contact this leader for that? Yes, and it's happened on more than one occasion. So it really has been great in the sense that we've obviously executed it so well that it's left, a number of different impressions and ripples. So it helps me on my end, I still continue to try to meet with as many physicians as possible, but it's wonderful that the content is speaking for itself in many instances.
Content in motion is what is the visual that comes to mind when you describe that domino effect. I love it.
Absolutely.
Thank you for sharing that, Sarah. Well, Sarah, my listeners know that anything we discuss here today is going to be linked up in our show notes at socialbusinessengine.com. I would also like to include anything that you'd like to refer people to connect with you or get to know more about what you're doing at IU Health. Where would you like to refer people online?
Absolutely. Well, to take a look at our news hub, go to iuhealth.org/news-hub/.
Okay. Well, we will get that linked up in our show notes as always. So, Sarah, thank you so much for jumping on the podcast with me here today to share your story about what you're doing at IU Health. It's really impressive. I love every aspect of it. And I want you to keep it going so you can come back in about a year and tell us about the new motion graphics that you created.
Absolutely. Thank you so much, Bernie. It was my pleasure.
Terrific. Well, I hope that you enjoyed my conversation with Sarah Burns, Editorial and Social Media Strategy Manager at IU Health. I want to remind you that this episode is sponsored by Outward Media, Inc., a leader in the direct marketing industry. I want you to download OMI's ebook, The Executive's 15-Minute Guide to Building a Successful Email Marketing Database, to discover the essentials for improving email deliverability. Get your copy now at outwardmedia.com/SBE, and you'll also find this link on the show notes page for this episode at our website at socialbusinessengine.com. Now, before I close out this episode, I want to invite you to become a member of our Social Business Engine community. Membership is totally free, and it provides access to premium content that we only make available to members, such as educational webcasts and even podcast extras. Now, our community is made up of thousands of business professionals whose common interest is using social media strategy, social technology, and social culture to create better business results and to improve their career. It's easy to become a member, and it's free. Just visit our website at socialbusinessengine.com. Well, that's going to do it for episode 126. I want to thank my guest once again, Sarah Burns, Editorial and Social Media Strategy Manager at IU Health. This is Bernie Borges, wishing you continued success on your social business journey.
Thank you for listening to the Social Business Engine podcast. Be sure to tune in again next week to reconnect with Bernie Borges for more insights, inspiration, and practical advice on social business. Visit socialbusinessengine.com to catch even more content on social strategy that will rock your business and your career.